And we are live.
Hello.
Hello, tribers. Can you see us? Please let us know in the comments if you can see and hear us well. Let me just check if we are live and visible on Tribe. Yes, we are very much visible on Tribe. All right. So, without any further ado, let's start with today's session. The topic for today's session is all about KMC, Kangaroo Mother Care, and KFC, which is Kangaroo Father Care. And to discuss this topic, we have with us Dr. Nitin M. Dr. Nitin is a highly qualified neonatologist with a strong background in pediatric medicine. He completed his MBBS from Kasturba Medical College, Mangalore in 2012 and went on to obtain his MD in pediatrics from Mysore College in 2016. Dr. Nitin then gained valuable experience working at renowned institutions such as St. John's Medical College, Bengaluru, and KS Hegde Medical Academy, Mangalore, where he honed his skills for over 2 years. In his pursuit of specialization, he completed his DM in neonatology from Maulana Azad Medical College, Delhi in 2021. This advanced training equipped him with comprehensive expertise in neonatal care, including specialized areas such as NICU care, newborn ventilation, CPAP, growth monitoring, and nutrition. Dr. Nitin is driven by a genuine passion for the well being of children and strives to provide the highest quality care to his patients. With his extensive education, training, and experience, he is well equipped to address the unique healthcare needs of newborns and ensure their optimal development and growth. Welcome to the session, Doctor.
Hello. Good evening.
Doctor, any
Thank
opening
you.
thoughts for today's session?
This is one of the growing trends in the NICU and NICU. This KMC was well known from quite some time. Now the KFC also has come. Like any other person can give similar thing, and this has a lot of benefits that I think we'll go through in detail in the subsequent questions. Your voice is not audible.
Am I audible now?
Yeah, yeah.
Okay. So, Doctor, how does KMC positively impact premature infants? And are there any specific nutritional considerations for mothers who practice KMC?
So as far as a mother is concerned, see the pregnancy requires a different amount of calories, and post-pregnancy the lactation requires almost much higher than the calorie requirement during pregnancy. We can say around 350 to
Yeah.
400. So KMC is almost the calorie requirement maybe almost similar to the lactation thing, but mother will be having some work like keeping the baby in between her breast and lying down there like in an inclined position. So maybe her work may be restrained, but I think the calorie requirement should be the same. So whatever she used to take during her
Okay.
lactation, what all the requirement is there, that is almost the same during the KMC. But she needs little more time, little more support from the family, so that she can give this care for the premature who is not given the care because of the early delivery. Ideally, the womb, gives the nutrition, warmth, everything for the baby. That is deprived for the preterm. That is given artificially by the mother. So whenever the mother breathes, that stimulates the baby. That stimulates baby's breathing. So the growth will be good, the development will be good, the outcome will be good. Chances of short-term things like apnea, desaturation, baby not breathing, such things are not quite less. And we also see the digestibility of the milk is more, and the mother's breast milk also increases during this time. And regarding the baby premature, any baby can be given KMC. Right now the concept is immediate KMC. Immediately after delivery, even though the baby is in ventilator or any other support, mother can continue to give KMC if the support is available, if that equipment is available. Most of the hospitals generally don't have that. So what we do is, once the baby is out of the support, once the baby is on milk, Then we start giving KMC. Okay.
Doctor, could you please elaborate what exactly is KMC and how can parents practice that?
So KMC is a name given for KMC Kangaroo Mother Care. We know that the mammal kangaroo, how it takes care of the baby in the in the covering, in the pouch in front. So the baby will be much protected from any danger, and baby also gets nutrition via breast milk. Okay, the kangaroo milk. So what we do is mother will be in some hospital have the separate chair for KMC, which is a reclining chair, and mother will be holding the baby in between her breast, and then she can uh, cover the area later. Okay, and baby will be wearing only the diaper. So what this will help is this will give warmth to the baby, and mother, of course, the minimum duration of KMC is 2 hours. It can extend anyway be about 12 hours also, but the minimum duration is 2 hours is required. Otherwise, baby going out, coming in, chances of many other things are more. Minimum 2 hours, and nothing much is required for the mother. She can also practice this at home when she goes back, but she might need the support required. Why? Because she may not be able to get up. Somebody else might will be needed for the assistance. As far as the mother is concerned, it's just she has to lie down, keep the baby in between her breast, and whenever there is demand, or every 2 hours, she needs to nurse the baby. Okay, this will increase her milk output, and this will help her even the psychological betterment also. The stress, everything will come down. Why? Because she's with the baby now, which was there when the baby was inside her tummy. Okay.
Right. Okay. And for fathers engaging in KFC, how can they actively support and encourage first healthy eating habits and also optimal well-being of the mother and child during KMC?
Yeah, so what father can do is if mother is continuing to giving the KMC, he can assist the mother in whatever activities she was supposed to do, which she can't do while she's doing KMC. Maybe the nutrition, the caring of the baby, and other requirement for her food and other things, he can assist. And even the father also can do the KMC. The concept is almost similar. It's the warmth which the baby needs. So one thing is he can't feed the baby, he has to give it to the mother for the breastfeeding or for the other thing, but rest all thing he can do. Okay, it's almost similar like the mother. He also has to be in a reclined position, and in the bare chest he'll keep the baby and then cover the baby. The separate suits are available for the KMC purpose only, which is easy for the mother and the father to wear. Okay.
All right. And are there any? Oh, there are separate suits for the
Yeah,
kangaroo
yeah.
mother
Some
care.
hospitals have separate suits so that it is easy for the mother to keep the baby in between the breast. Otherwise, whatever she's wearing in the hospital, that is well and good. Okay.
Okay. So without suits, also it can be practiced.
Yeah, yeah. It's just that the baby has to
Right.
be kept in between the mother's breast so that the baby gets the warmth, gets the stimulation, gets the mother's breathing will in turn make the baby move a little up, down. That will stimulate the baby, and even the mother's heartbeat also will be reciprocated in the baby.
Right. Okay. And are there any specific nutritional needs? Because the mother needs to be very healthy to support the baby and the
Okay.
breastfeeding at that time. So, what are the specific nutritional needs that a new parent needs to be aware of and follow?
Yeah, as I told, the mother's requirement of nutrition will be much more than what she's taking during pregnancy. Why? Because she's also lactating. She's also breastfeeding the baby. That requires almost 300, 400 more, kilocalorie than the pregnancy time, than the normal time. So she will take all the good food and the good nutrition. She should drink plenty of water and at least 1 or 2 liters. Generally, we tell milk and all she should drink properly, and she should eat the healthy foods. That automatically she will only come to know that her demand will be more, she'll eat more, but avoid as far as possible the junk foods are concerned. Rest, I think, I'm almost like the any other mother who is lactating and feeding, the same she can follow. But here she requires little more time to support the baby.
All right. Doctor, are there any specific conditions where a KMC is much more required as opposed to a regular delivery and a regular
See,
birth?
the KMC is generally the term is generally given for the premature baby. So premature baby normally in the NICU we keep the baby in the warmer. The warmth is given through the to the warmer, and we connect to the monitors and all. We monitor the baby, we feed every 2 hourly. So baby who is born early, deprived of the nutrition, deprived of the warmth, deprived of such things, is provided in the NICU. Once the baby is coming out of the NICU, the same has to be provided. Okay, same has to be provided. Like the feeding has to be given every 2 hour or as the doctor tells, and the other care has to be given. So what all is deprived? See, normally baby should be born at 9 months. The baby is born early. All these will be deprived. So we give artificially, so that the baby is in par to the other kids. We see the outcomes like the development of the baby is much better than the baby who's not given KMC.
Right. So apart from development, are there any other outcomes that are very evident because of the
See,
kangaroo
the
mother care?
growth is good, the development is good, the short term effects like apnea, the baby not breathing, desaturation, the oxygen level coming down, such things are very much less, and baby will be more playful, okay, and more active. That is important. That all we get with the KMC.
Right. And up to what age should that be continued for the child?
So generally we tell up to 34 weeks is enough, 32 to 34 weeks. Okay. She can
Okay.
continue
Okay.
any time later also, but up to this is generally required. Okay.
All right. And any precautions that the mother and father need to take
Nothing. They
while?
should be healthy. They should be clean. They should bath and then give the KMC. The cloth and other things should be fresh. Why? Because it's a premature baby. Chances of infection, such things will be more. So that has to be taken care as usual. As how the mother comes to NICU, she washes, she will be fresh, bath. Same thing has to be followed when the mother is giving KMC.
All right. All right. So, doctor, any other aspects about KMC that we've missed out on? We've covered the nutrition and the hygiene factor of it.
I think we have covered almost all. What mothers should know is this is a simple concept. We additionally, nurse the baby, keeping our body in close contact with the baby. That is all. Rest everything is the same like the normal mother, normal lactating mother. Her nutrition, everything is same, but she needs little more support. Why? Because she can't always get up holding the baby. She needs somebody to assist her and help her. Okay.
Right. Okay. So, we've covered almost all aspects of it, unless we've missed out on anything and you would like to add anything more to it.
I think it's almost all covered. Whatever they should know, it's given. And any mother can practice KMC, any father can practice KMC. But then most should be, adjustable to each other and supporting each other. That is important.
Okay, great. Thank you so much, Doctor. I think with that, we are at the end of today's
Mhm.
questions as well. We will
Okay.
have some questions from viewers who watch this session later
Okay.
on. So, we'll
Mhm.
certainly be passing those on to you. Thank you so much, Doctor, for taking out your precious time and sharing all this
Okay.
information
Okay.
with us.
Yeah. Welcome. Thank you.
We hope to see you soon on next interesting session with us just on
Yeah.
parent-child
Yeah.
rights.
Yeah. Yeah. We have any questions from the audience?
No, as of now, we don't have any questions from the audience.
Okay.
Once we have any, I would share those with you, but at the moment, we don't have any questions.
Okay, thank you then. Thank you. Thanks for the opportunity. I think it's the second time we are interacting. The few
Yes,
months back we had one more, and
yes.
this is what mothers should know is this is a simple concept. Maybe the name is little more complicating. She should nurse the baby and feed the baby. That as usual she will do. Additionally, she will make sure the baby is getting her warmth. It is as simple as that. Any mother can practice it. Okay.
Right. We have a viewer asking, shall I practice KMC with my 5-month-old baby?
Not required maybe. KMC generally the baby may be if you see the weight per se, the baby's weight may be a little more, mother may be a little uncomfortable also. If she can practice, she can do. There's no harm in giving it, but she should be a little careful. Because baby may be more active, playful, not like sleeping as a preterm baby. Preterm babies usually sleep for long. Such thing may not be there in the 5-month baby. Okay.
Okay. With that, we are at the
Okay.
end of today's
Okay. Yeah.
questions.
Mm-hmm.
So, thank you so much, Doctor, once again for being
Thank
with
you.
us
Thank you.
and sharing all this knowledge with us.
Okay, welcome. And thank you. Thanks for the opportunity. It's been quite interesting to talk to you and share some of my views. And thank you once again. Yeah. Okay.
Thank you so much, all the tribers, for joining us today. With that, it's a wrap on today's session. If you have any more queries about this topic, please let us know in the comments. And with that, it's a wrap on today's session. Stay tuned for more interesting sessions just on Parent Child by Super Bottoms. Thank you so much.
Thank you. Thank you.